Research Foundation, we are pleased to present you with an international melanoma researcher video of solidarity. During these challenging times, it's been amazing to see how the research community has come together to not only work on melanoma, but to pivot to COVID-19 research. We are so proud to present you with this video to showcase their good work and to show the great passion they have for continuing the fight against melanoma. Now, let's see what Dr. Atkins is doing right here in our backyard in Washington, D.C.
I created COVID-19 contingency plans for my national melanoma trial in order to preserve the safety of the patients and the integrity of the research. Now on to you, Ashley.
Thanks, Mike. Here at the Johns Hopkins School of Public Health, we are continuing to further our public health missions. It's not just all COVID all the time. We recently held a skin cancer awareness forum right before Memorial Day weekend, and we are continuing to do our research virtually for now, but gearing up for a return back to the labs in the next couple of weeks, for which we're super excited. I'll turn it over to you in New York, Rich.
Although COVID-19 has hit New York City particularly hard, it has led to new collaborations focused on understanding how this virus is affecting our patients with melanoma and what we need to do to ensure we continue to deliver the best care to all of our patients despite these challenging circumstances. Hi, Dr. Flaherty. What's going on in Boston?
I'm working with a small army of infectious disease, pulmonary critical care, and immunology experts at Mass General to take the same clinical translational approach that has been so successful for us in melanoma, therapeutic development, and analysis of patient specimens to COVID-19. Paolo, how are things going in Naples?
This is Paolo Scerto from Naples, Italy, and this is our study coordinator's room. And as you can see, some of my collaborators are working to clinical trials, others are in smart working, as you can see. So we still continue our effort in the clinical research.
Life gradually coming back to normal in Beijing. Although some minor adjustments have to be made because of COVID-19, like presenting at the virtual ASCO annual meeting from home. How is it going on in San Francisco?
Despite the COVID crisis, if you have signs or symptoms of melanoma, it's important not to delay your care and come right on for treatment.
We're getting back to clinical trials work here in Los Angeles and have recruited Dr. Memi and Dr. Boyko to our team for melanoma research. What's going on in Pittsburgh, Dr. Kirkwood?
Hello all, this is John Kirkwood from Pittsburgh, and I'm happy to greet you from Pittsburgh, where we've had snow in the past week and 26-degree temperatures still in the second week of May. Happily today, we've entered the yellow phase of Governor Wolf's stay-at-home order, so we'll resume our work in the clinics much more consistently. Throughout the entire COVID episode, we've actually continued the clinics and had therapeutic visits and trials uninterrupted, but I think we will slowly, cautiously re-enter the work as usual, which will of course not be usual for any of us going forward. I'll turn it back to you, Kylie. All the best.
We hope you all enjoyed this trip around the globe, and we'd especially like to thank our research and scientific community for taking part in this fun project. We would also like to thank Dr. Paul Chapman, who brought this idea to the MRF. And we'd like to thank all of you for your support during this tough time. On behalf of the MRF board and staff, we wish you all continued good health, and we look forward to a day where we have a cure for melanoma.